Hi everyone, my name is Hannah Neilson Welch, and I'm going to be presenting to you today on a report I created during my practicum at the BC Ministry of Health called Climate Change and Health in British Columbia, Supporting Our Research Agenda for the BC Ministry of Health. So before I begin my presentation, I want to acknowledge with deep respect and gratitude that I'm presenting today from the traditional territory of the Lekwungen peoples, known today as the Songhees and Esquimalt First Nations, and the home of the Métis Chartered Community of Greater Victoria. So starting off with the background and why this report is important. So across British Columbia, health will be impacted by climate change in multiple ways. Most recently, BC has been at the forefront of extreme weather events and their resulting natural disasters. For example, in the summer of 2021, BC experienced a catastrophic heat dome, and following this event in the fall of 2021, BC was faced with a flood event as a result of extreme precipitation. Forest fires in BC have also become much more frequent in recent years, and all of these events have significant implications for human health, some of which include increased rates of mortality, decreased mental health, compromised food and water safety, and respiratory health challenges. So there's evidence to suggest that climate change will not only impact human health, but also health systems. And this is not only as a result of increased hospital visits, but also due to other factors which will threaten health system infrastructure, service delivery, and economic stability. And in response to these risks, the World Health Organization operational framework for building climate resilient health systems exists as a climate and health framework that may support the building of a climate resilient health system in BC. And this framework is illustrated to the right of the slide here. And you can see that it's really guided by 6 key building blocks, which make up the inner circle here, and 10 key components, which align the outer circle. And this report focuses specifically on the health information systems building block with a particular emphasis on the health and climate research component. So this slide just details the methods employed to create this report. So multiple databases were used for the literature search, and papers with relevant abstracts and titles were collated into an Excel document. The summary of research on climate change and health in BC section of the report, which will be discussed in the following slide, focused primarily on academic literature specific to BC. And it's important to note at this point as well that due to the broad nature of the topic of climate change and health, as well as the limited time to complete the report, the information presented today may not necessarily be representative of all the climate-related health impacts known to exist in BC. So starting off with a summary of research on climate change and health in BC, this section focused primarily on 3 climate-related events and their intersection with human health. And those 3 events are wildfires, extreme heat, and flooding due to extreme precipitation. So starting with wildfires, the academic literature suggests that wildfires can result in respiratory health complications, cardiovascular health issues, diabetes complications, and increased prevalence of ear infection. Additionally, some rural and remote communities, as well as some First Nations communities in BC, have also identified decreased mental health as an impact of wildfire evacuations and/or displacement. In terms of extreme heat, the academic literature made connections between extreme heat and increased rates of mortality, as well as decreased mental health. And some First Nations communities in BC have also identified decreased social and cultural well-being, heat stress, as well as respiratory health issues as impacts of extreme heat as well. Flooding was the least studied out of all 3 climate change events. However, the academic literature did make associations between flooding and decreased mental health, as well as increased risk of illness due to consumption of contaminated food and water. So the next section of the report outlined some gaps in and opportunities for climate and health research in BC. And the information presented here is really based on and informed by the academic literature findings presented in the previous slide. So I won't go through all of these in detail, but some gaps which were common to all 3 climate-related events include research on the mental health impacts, as well as research on the experiences of population groups in BC who are more vulnerable to the impacts of climate change. And in particular, the experiences of Métis, Inuit, and off-reserve First Nations peoples in BC were found to be severely represented in BC research. Despite these gaps, there exist multiple opportunities. So starting off with wildfires, the majority of research on wildfires and health in BC has focused primarily on the physical health impacts of wildfires, and particularly in relation to particulate matter. And particulate matter is an air pollutant in wildfire smoke that's been known to cause human health issues. However, there are many other components of wildfire smoke as well, and many other air pollutants that may pose a risk to human health, some of which include ozone, carbon monoxide, and nitrogen dioxide. And in particular, with regard to cardiovascular health, many studies have attempted to explore the association between wildfires and cardiovascular health, particularly again in relation to exposure to particulate matter. And many of these studies have been met with mixed findings. So knowing that there are other air pollutants present in wildfire smoke really presents an opportunity to potentially solidify these mixed findings. In terms of extreme heat, the majority of research on extreme heat and health in BC has focused on extreme heat mortality. And one paper also focused on the mental health impacts of extreme heat, particularly in relation to anxiety. And this paper really serves as a foundation for hopefully more research in this area of mental health and climate change. Additionally, a lot of the research on extreme heat and health also focused on the risk and protective factors associated with extreme heat mortality. And this information should be both explored further, but also used to inform future policy initiatives. Challenges have also been identified in terms of measuring the health impacts of extreme heat in rural and remote communities due to their small size. And knowing these challenges exist really presents an opportunity to explore ways to address those challenges. Lastly, in terms of flooding, as disastrous and detrimental as the 2021 flooding event was for many British Columbians and people in BC, it really presents the opportunity to conduct more research that's BC specific in this area of climate change and health. So as I mentioned earlier, climate change will not only impact human health, but also health systems. And conducting climate and health research presents the opportunity to strengthen the health information systems building block of the WHO operational framework for building climate resilient health systems. And in support of this opportunity, Health Canada has identified additional gaps in research specifically related to health systems that must be addressed to build climate resilience. And some of those gaps include research on identifying adaptation measures and strategies, the benefits of climate strategy or strategies to build climate resilient health systems, and research on the health co-benefits of climate strategies as well. So we know that gaps exist and opportunities also exist for research related to climate and health in BC. And so it's essential that we move towards addressing those gaps and seizing those opportunities. And so informed by the report and by the information presented today, some next steps for the BC Ministry of Health to consider were put forward as well. And those next steps really revolve around accessing climate and health researchers, building partnerships, seizing funding opportunities, promoting knowledge sharing opportunities and providing knowledge sharing opportunities, and collaborating to define the federal climate and health research agenda. So as we're nearing the end of the presentation, I just want to touch on a few strengths and limitations of the report. So as I mentioned earlier, the topic of climate change and health is quite broad, and this in combination with the limited time to complete the report led to a narrowed scope of the report itself, which limited the amount of research that could be found and summarized. Additionally, the scope of this report was restricted to examining the BC specific climate-related health impacts and did not explore those in other jurisdictions. Despite these limitations, there are also multiple strengths of the report. So the report may lead to a greater awareness of climate-related health impacts and health system impacts as well in BC. And the report really outlines a partial solution to mitigating the impacts of climate change on health and the health system by discussing research priorities that the BC Ministry of Health should focus on addressing going forward. And because of these two strengths, the report may elevate the prioritization of climate change work across BC health organizations. So that concludes my presentation for today. Thank you all so much for watching and listening. And I do want to give a very special thanks to my 3 practicum supervisors at the BC Ministry of Health, as well as my practicum instructors at UVic for their support and guidance throughout this process. And now I will open it up for questions and comments.